Good morning, everyone. Today we are discussing about abdomen, its anatomical structure from a osteopathy and physiotherapy perspective. When we are going to manipulate visceral organs, we should know the structures of abdomen layer by layer. On palpation, and when we are doing our manipulation of viscera, we should know where we are. So we start our topic today. Know your abdomen by osteopathic perspective. So, know your abdomen from an osteopathic perspective is a topic in which we discuss the all abdominal structure layer by layer. First of all this material which are used in this presentation is work done by Dr. Gil Hadley, PhD, and all materials are copyright. And I am very thankful to Gil Hadley to give me permission to present his work to share the knowledge. If you want more knowledge or more information, you can visit his YouTube channel, Somanot, or website www.gilhadley.com. So first of all, abdomen is divided into abdominopelvic region and abdominopelvic quadrants. In your left, there are 9 abdominopelvic regions. First is right hypochondric region, in middle epigastric region, left hypochondric region. In the middle, right lumbar region, umbilical region, left lumbar region. In the lower one, right iliac region, hypogastric region, left iliac region. In your right, there are 4 quadrants: right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. So what is visceral manipulation? Visceral manipulation is the manipulation of the viscera which are done by osteopath to increase the mobility and motility of the visceral organs and to correct if any deformation or any misalignment is there. So we correct by visceral manipulation. So mobility of viscera is a gross movement and motility of viscera is a inert motion, which is denoted by expiration and inspiration. The rhythm of the viscera is 6 to 8 per minute. So first of all, when we are palpating, the first palpating structure is the skin. Skin is the largest structure in our body. And when we remove the skin, the next structure is superficial fascia. When we remove the skin, the back surface of the skin is seen like this. This is the back surface of the skin. And the next structure after removing the skin is superficial fascia. It is a thick structure, more thicker than the skin. And the most people doesn't recognize what is superficial fascia. It is yellow in color, as you saw the color is yellow. It is made up of loose alveolar connective tissue. In some area, this superficial fascia is thick, and in some area it is thin. In example, in leg area it is thin, and in belly area and glute area or breast area it is thicker. The arteries, veins, nerves, all are present within the superficial fascia. And the most interesting thing is that the shape of the human body is given by this superficial fascia layer. If we remove the superficial fascia of the fat person or a thin person, then after that, the body is almost same. So the shape of the body is given by the superficial fascia. So superficial fascia, previously it only superficial fascia, but after researches we know that it's two parts: camper fascia or scarpa fascia. Scarpa fascia is a thin layer. And then relationship between superficial fascia and deep fascia. Superficial fascia is adhered to the deep fascia. It is not that layer is not connected. If we remove the layer, it comes out easily. The superficial fascia is invade in the deep fascia by the connective tissue. These are the thick collagen fiber strands which are invade in the deep fascia. So what is deep fascia? Deep fascia, we are talking about abdomen. In your extreme right, it's a abdominal deep fascia known as anterior rectus sheath, but deep fascia present everywhere in the human body. In the right side, you can see the thigh and leg figures in which deep fascia is present. So what is deep fascia? It is a deep, shiny layer. It's a broad connective tissue. All fascia is connective tissue, but all connective tissue is not a fascia. Some thought that this is the muscular layer. On abdomen, if you see, it's some people thought like that it's a muscles, but it's not a muscle. It's a covering of the muscles. If we remove this deep fascia, it's a shiny sheath. If we remove, then underlying these muscles are present. And the compartment of the muscle is also made up by this deep fascia. And the interesting thing is that this fascia is a contractile structure. Previously, people don't know about this contractile property of the fascia. Now, everybody knows deep fascia is a contractile structure. And deep fascia is connecting with muscles with epimysium of the muscle, like superfascia is invade in deep fascia and deep fascia invade in muscles. After removing this deep fascia, then muscles are visible. When we remove this deep fascia, then abdominal muscles are appear, which are rectus abdominis, external oblique, and internal oblique. In figure, you can easily see the rectus abdominis, external and internal oblique muscles. When we remove these muscles, then next structure is visible, that is posterior rectus sheath. This posterior rectus sheath, or known as posterior wall of the abdomen, is composed of fusion of the aponeurosis of external oblique, internal oblique, and transverse abdominal muscles. When we remove this posterior rectal sheath, then the next layer is parietal peritoneum. It's a layer on viscera. Is that portion that lies the abdomen and pelvic cavity. This is a thin layer known as parietal peritoneum. After parietal peritoneum, there is a thick fibrous layer which is known as greater omentum, which covers almost whole abdomen, attached with the stomach and transverse column. It is a 4-layer fold of peritoneum. The function of this greater omentum is to lubricate viscera for motion and protection of the viscera. Right? Then next is the viscera. When we remove this greater omentum, then visceral organs are visible. Then you can easily see the intestinal structure in the abdominal cavity. So next structure is lesser omentum. The lesser omentum is the connecting fascia between lesser curvature of stomach and liver. Here in this you can see this is the lesser omentum. Where arrow is this? This is the lesser omentum, is a connecting link between connecting fascia between liver and stomach. This is known as lesser curvature of the stomach. This is known as lesser omentum. Then come to the next. This is the small intestine. The small intestine is a loop-like structure, like flowers or bouquet, and it's a several loops in the small intestine. Then these all intestines are within the abdominal cavity. It's spread all over. And after small intestine, the next structure is mesentery. Mesentery, it's a very interesting structure which connects small intestine. It's a fabric-like structure. When you see, this is the mesentery. That it's a loop of the small intestine and front or back of the intestine. This structure, this fan-like structure, is a mesentery. And within the mesentery, this you can see easily the blood vessels are visible more clearly. So this is the mesentery and fold of the membrane at the intestine and abdominal wall. Then next is the root of mesentery. When we collect all the intestine here, there is the root of mesentery. From here, the all mesentery is covered all the loops of the this small intestine, and this part is mesocolon. Right? Then come to the duodenum. Duodenum is the first part of the small intestine. This is stomach, and this C-shaped structure is a duodenum. Duodenum is the first part of the intestine. Next is duodeno-jejunal junction. Is a border between the duodenum and jejunum. This one is duodeno-jejunal junction, and it's a, this small opening retro peritoneal. This is the peritoneal. Below this peritoneum, this duodenal junction is present here. So this is duodenal junction. And next is caecum. Caecum is a large tube-like structure in the lower abdominal cavity. This is a caecum where the small intestine and in the caecum as a ileocecal wall, and this caecum is a first part of the large intestine. This is this hollow bag is known as caecum. Now come to the ascending colon and hepatic flexure. On right, beginning part of the colon is the ascending colon. Here after caecum, this is the ascending colon, and hepatic flexure is the turn between ascending colon and transverse colon. This here is the hepatic flexure. It's an angle band of the colon between ascending and transverse colon. Then next is the transverse colon and splenic flexure. Transverse colon is run horizontally like this. Here it's a transverse colon, and here is a splenic flexure. Again, the loop or turn or band where the transverse colon and the descending colon, they make a band. It's known as a transverse colon and hepatic, splenic flexure. Then descending colon. This is the descending colon after transverse colon. On your right side, left side, this one is descending colon, and the end is a S-shaped structure is known as sigmoid colon. This sigmoid colon is the last part which leading to the rectum. And then the next part is kidney. These are the retroperitoneal structure. After removing the peritoneum, then the kidney is appear. The kidney is covered with the visceral peritoneum. One is parietal peritoneum and second is visceral peritoneum. The other layer which covered the visceral organs. The kidney is covered by visceral peritoneum, and after that parietal peritoneum. So known that on the kidney, at the top of the kidney, suprarenal gland or adrenal gland is present. But when we are going anatomically, the adrenal gland or suprarenal gland is far away from the kidney. Then next is the posterior abdominal wall. After this structure, last is posterior abdominal wall, which is made up of lumbar vertebra, pelvic girdle, posterior abdominal muscles, and their associated fascia. These posterior abdominal muscles are iliacus, psoas major, psoas minor, quadratus lumbar, and diaphragm. So this is all about the anatomical structures of the fascia, layer by layer. Thank you. If you have any doubt, please tell me. Thank you. Thanks.